global demand. During the Supreme Committee meeting, it was also decided to add a category of a vaccination target group next week, which means that this week will be starting from, this is the week that is going to be starting the vaccination, because this meeting was held last week on Thursday. So the category that has been decided to be added to the vaccination group is of the people aged 60. The Minister of Health affirmed the first immunization campaign covered 95% of its target segments vaccinated against coronavirus, which gives a total of 52,858 people in the Sultanate. He also explained that the Ministries of Health and Education coordinate about schooling during the second semester in the Sultanate, and that the appropriate decisions will be taken during the next meeting of the Supreme Committee, which is likely to be held this week. Now, Dr. Saif Salim Al-Abri, who is the Director General of Disease Control and Surveillance, unveiled the Health Ministry's plan to immunize 60% of target groups of most vulnerable segments, including frontline workers. He noted that a decline has been observed in the age group of 55 years due to vaccinations. In terms of institutional quarantine, there were a lot of questions that were asked from the Supreme Committee members on Thursday, and one of them was like, if a person who is coming into the Sultanate and is vaccinated, does that person still need to undergo quarantine? On that, Dr. Saif made it very clear that no, there is no exception. Even if the person is vaccinated, he or she still has to undergo quarantine for 7 days at the designated hotels. And from then, after that, they can actually be free of quarantine and live with the family or at any other place that they have in the Sultanate. In order to do that, you all know that there are a lot of packages by the various hotels in the Sultanate that have offered quarantine packages for single board and double board, which includes full package, including meals, 3 meals a day. So a person who is coming to the Sultanate can actually look into the packages and pre-book, because all this will be checked during the arrival at the airport. And once the confirmation is with the passenger, only then the person will be allowed to enter the Sultanate. Moreover, in today's episode, it's going to be a little different than the usual one, as we'll be talking about a very different topic, which is all about SARS-CoV-2 and potential airborne transmission, how it really works, what are the challenges, and how to be protected. But before that, let's take a quick commercial break.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to TTV. You're watching Fighting COVID. Now, before going on a short commercial break, I told you all that this time the episode is going to be a bit different than the previous ones, as in this episode, we are going to go back a little and talk about SARS-CoV-2 and the potential airborne transmission. Now, according to the Centers for Disease Control and Prevention, commonly known as CDC, the principal mode by which people are infected with SARS-CoV-2, the virus that causes coronavirus, is through exposure to respiratory droplets carrying infectious virus. Now, respiratory droplets are produced during exhalation, example, sneezing, coughing, speaking, breathing, singing, and span a wide spectrum of sizes that may be divided into 2 basic categories based on how long they can remain in suspended air. A, larger droplets, some of which are visible and that fall out of the air rapidly within seconds to minutes while close to the source. B, smaller droplets and particles formed when small droplets dry very quickly in the airstream that can remain suspended for many minutes to hours and travel far from the source on air currents. So once respiratory droplets are exhaled and as they move outward from the source, their concentration decreases through fallout from the air, largest droplets first, smaller later, and combined with dilution of the remaining smaller droplets and particles into the growing volume of air they encounter. Now, according to the experts at CDC, respiratory viruses are transmitted in multiple ways. Infections with respiratory viruses are principally transmitted through 3 modes. It includes contact, droplet, and last, airborne. Now let's look at these components step by step on the following. Now, talking about contact. Contact transmission is infection spread through direct contact with an infectious person. Example, touching during a handshake or with an article or surface that has become contaminated. The latter is sometimes referred as formite transmission. Now the second one, droplet. Droplet transmission is infection spread through exposure to virus containing respiratory droplets. Now that is larger and smaller droplets and particles exhaled by an infectious person. Transmission is most likely to occur when someone is close to the infectious person, generally with about 6 feet. Now the third one, which is airborne. What happens in airborne transmission is that infection spread through exposure to those virus-containing respiratory droplets comprised of smaller droplets and particles that can remain suspended in the air over long distances, usually greater than 6 feet, and time typically hours. Now, droplet transmission consists of exposure to larger droplets, smaller droplets, and particles when a person is close to an infected person. Airborne transmission consists of exposure to smaller droplets and particles at greater distances or over longer times. You'll be surprised to know that the epidemiology of SARS-CoV-2 virus indicates that most infections are spread through close contact, not airborne transmission. According to the researchers and scientists, diseases that are spread efficiently through airborne transmission tend to have high attack rates because they can quickly reach and infect many people in a short period of time. They say that a significant proportion of SARS-CoV-2 infections, which is estimated to be between 40 to 45%, occur without symptoms, and that infection can be spread by people showing no symptoms. Thus, where SARS-CoV-2 spread primarily through airborne transmission like measles, experts would expect to have observed considerably more rapid global spread of infection in early 2020 and higher percentages of prior infection measures by serosurveys. Available data indicate that SARS-CoV-2 has spread more like most other common respiratory viruses, primarily through respiratory droplet transmission within a short range, for example, less than 6 feet. There is no evidence of efficient spread that is routine or rapid spread to people far away or who enter a space hours after infectious person was there. Now let's have a look at the prevention of COVID-19 through airborne transmission. Now, existing interventions to prevent the spread of SARS-CoV-2 infection appear sufficient to address transmission both through close contact and under the special circumstances available and favorable to potential airborne transmission. Among these interventions, which include social distancing, use of masks in the community, hand hygiene, and surface cleaning and disinfection, ventilation and avoidance of crowded indoor spaces are especially relevant for enclosed spaces where circumstances can increase the concentration of suspended small droplets and particles carrying infectious virus. However, at this time, there is no indication of a general community need to use special engineering controls such as those required to protect against airborne transmission of infections like measles or tuberculosis in healthcare setting. Make sure that you adhere to precautionary measures that has been issued by the Ministry of Health and the Supreme Committee in the Sultanate of Oman that is not just going to keep you protected, but as well as those around you. This was all from our Fighting COVID studio. Let's go back to Antara.
Thank you, Madiha, for those updates and those really interesting facts on SARS-CoV-2. And that was Fighting COVID on Outline. We'll be back tomorrow with midday updates, so stay tuned.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.